what changes will you be seeing in hospital campuses? Again, trying to pick up on all these challenges that Don mentioned. Where do you see those challenges being addressed from a design perspective?
Well, so as a firm that specializes in exterior facade restoration, the envelope of the building, over the past 30 years, especially high-rise buildings, of which there are many healthcare facilities in New York City that are high-rises. We have had the opportunity, I've had the opportunity to work over the last 20 years for several healthcare clients. And what I've seen is that in the last, let's say 15 years ago, the focus was more reactive. The buildings had problems, there were leaks, there were unsafe conditions on facades, and we were focusing on solving those problems. Certainly there was the need for inspections, facade inspections, which will always be necessary, and maintenance as well as dealing with emergencies. However, it seems to have been a reactive type of a repair process. In the recent years, in the last 5-8 years or so, I see that, and there was also a big aspect of the historic preservation of some of these facilities. A lot of these buildings have not been touched for 30, 40, 50 years. They're beautiful buildings on many campuses, and as you know, according to New York City data, 90% of the existing building stock in New York City is still going to be here 25 years from now, so it's not all going to be replaced with new construction. So in the past, we were restoring landmarks, we were fixing problems. Now I find that we will continue to repair buildings, we will continue to inspect them. However, the focus is a little bit more on sustainability. We are much more involved with very educated teams of facility managers, directors, planners, construction managers who are planning very large expansion projects on most of these campuses. Therefore, the preservation of their existing buildings and the maintenance of their existing buildings is done a little differently these days with that focus on the future.
So picking up on that last answer, how does a firm like yours really work closely with the hospital for their expansion or downsizing plans to address those challenges that they face?
Well, we've been hired numerous times, and I know there are all sorts of feasibility studies that many professionals who are here prepare for their clients, but we've worked on numerous building envelope inspection reports where we have to look at, let's say, 55 buildings, and within a month, sometimes, or two, because our clients are extremely busy and usually have to produce very quickly as well. We have to gather a team, inspect these buildings, prepare cost estimates of what these buildings' needs will be. And again, we're focusing on the exterior primarily in terms of roofing, windows, facade restoration over the next 5, 10, 15, 20 years. These reports help our clients obviously budget for these projects and sometimes help them decide what to downsize and sometimes even what to purchase and if to purchase it. There's been a lot of changes in buildings in terms of going up above existing buildings, attaching to the sides and expanding in that direction over highways, garages. There's new thinking about what functions garages can serve above the garage space, the air rights, and so forth. So we prepare reports, and then obviously when we get into the design, bidding, and construction phase, we are very much involved in accommodating the needs of our clients. We try to make sure that sections of buildings that are going to be demolished or attached to within the next 4 or 5 years, we might do a short-term, less expensive repair on that facade if we know it's not going to be here in the future. As far as there might be a project going on simultaneously where a new tower is being built, we might capitalize on the protection at the sidewalk level, which is very often very expensive, let's say over the FDR 5, and we might structure a restoration project to kind of complement another project, which is a new construction project. So that's the kind of planning that we sometimes assist our clients with.
So Bill,